Hi, and welcome back to another episode of the Healthy Aging Telecast. Today, we're going to be talking with Dr. Douglas Scharre. He's the director of the Division of Cognitive Neurology at Ohio State University. And we're going to be talking about memory and cognitive issues as you age. So stay tuned. Hi, and welcome back. I'm Kathy Tutt, and I'm the Family Consumer Sciences Educator with Ohio State University Extension in Clark County. Today, we are joined by Dr. Douglas Scharre, who is the Director of the Division of Cognitive Neurology at Ohio State University. So everyone forgets from time to time, and it does become a concern for us as we age. So I am going to ask Dr. Scharre to share with us some of those things that usually happen to us as we age related to our memory and our changes cognitively. So Doug, I'm going to let you take it away.
Great. Thank you very much. Greetings, everyone. I'm Doug Scharre. I'm at the Ohio State University. I've been there since 1993. I'm a neurologist and see patients with cognitive issues, memory problems, and dementia issues. We do a lot of clinical research, have a lot of different studies to try to help people and caregivers with their cognitive issues, and have developed tests to measure cognitive issues. And what I wanted to chat about with you today is basically normal aging and how do you tell that it's not normal aging. And so as a cognitive neurologist, we sort of put people into three different groups. There's this thing called normal. And normal is, I really don't know how to define that, but everyone has their own set of talents. So some may be fabulous at talking and words, others may be fabulous at math skills, others may be fabulous at directions. So you could be lousy at directions and good at language. Everyone has different talents. And so that's your normal. And we want to see if there's any change from your normal over time. So there's normal, there's this group called mild cognitive impairment, and then this group called dementia, when you have such low cognitive functioning that you need some help in doing day-to-day activities. So this mild cognitive impairment is a step below your normal. So you're struggling, you're less efficient in doing things that you used to do, but you can still get it done. You go to the store, you forget your list, and you're inefficient. You go back home, oh gosh, the tomatoes, I forgot, so you're wasting time, but you still can shop. You can still pay for things. Or messing up on your TV remote and someone reminds you, you got to push that and that, and okay, I can do it myself and figure it out. Or you misplace a bill, you get a late fee. Oh gosh, where did I put that? You find it, you know how to pay for it, you figure it out, but you're inefficient, you're paying extra fees, you're not normal. That's not you. You're not normally late like this. So that's called mild cognitive impairment. So normal, mild cognitive impairment. And then dementia basically are individuals that they can no longer do that task by themselves. They need someone else's help. So they get a bills, they don't know how to figure out how to pay their bills online anymore. They used to, but it's too confusing. How do I pay it? Someone else has to take over the task. Or I used to be able to cook simpler meals. Now I'm really struggling with cooking, and they want you to stay away from the stove, so someone else is doing your cooking for you, can't do it anymore. That's dementia, or you can't figure out a TV remote, even if someone told you, you're picking it up and you think it's a phone as opposed to the TV remote or something like that. So you no longer can do these technology things. You can't figure out your own medications. Someone has to give them to you. You used to be able to put them in a pill box and get them at the right time, but now it's too confusing. You forget. Someone else has to do that task for you. That's dementia. So we have normal, mild cognitive impairment, and dementia. And so normally, as we age, our cognitive issues get worse. Our brain cells don't regenerate, right? So you have the same brain cells you had when you were born, basically. And so if one dies, it's gone. right? Skin cells, you can bruise yourself or scrape yourself and the skin grows back, and kidney can, a lot of other organs and things can sort of regenerate and grow back. Brain can't do that. So over the years, you're going to have some normal aging process. You're going to lose some cells. You've had a few head traumas, maybe a small TIA or a stroke, or you're on chemo, or variety of things happen to your brain that make it not work well. And so that's just sort of normal aging process. So how do we tell the difference between that and, say, something like Alzheimer's or a degenerative condition where there's actually some pathological issue going on with the brain? So I'll give you some hints. The topic today really is what's normal aging, don't worry about it, or what's something, hey, you should go maybe see your physician about. And the first thing we can discuss with that regarding that is maybe a memory. So as you get older, your memory fades, you can have more forgetfulness. So, if you occasionally misplace an items or you forget an event and someone reminds you, that's normal. Say you, for example, say you misplace your keys or your phone, and you're looking for it and you go, oh my gosh, where is it? Eventually you find it. And there it is on the entry table or something. If you can say to yourself, I rushed in, I had to put it down, I got to go to the bathroom, I had to answer the phone or whatever, and you can recall exactly how those keys or phone got there, normal. You're cluing well. All right. A patient with early Alzheimer's or something that's not normal aging, they'll see their phone or their keys there. They'll have no idea how they got there. They'll probably accuse you must have moved it, or accuse someone else. Usually the spouse is the main one they accuse, of course, the closest person, right? So they're not cluing well. That is not normal. You should go in and see a doctor about that. You might ask a person, what'd you have for lunch yesterday? Lunch? I don't know. Did I have lunch? Or, what did I do? I can't really remember, So you give that person a clue and you say, remember, you went out with your daughter. And if the person could then say, oh, that's right. We went to this nice place. We had this waiter or waitress. I had this, she had that. We talked about such and such. If it all comes flooding back, normal. That's just a normal forgetfulness of aging. Brain is working okay. If you're beginning to have cognitive issues with memory and it's not working well, then you tell the individual, you say, well, you went out with your daughter. They go, oh yeah, that's right, I went with my daughter. Then you say, well, what'd you have to eat? What did I have to eat? Where'd you go? Where did I go? That is not normal. If you have to clue every step of the way and they're not retaining it, go see a doctor. Other things to think about: language function. All right. So forgetting words, for example, or what's that name of it, such and such. What is normal is forgetting names of people or actors, actresses, book titles. Normal. Everyone forgets names of people. Some are better at it than others. As you age, it seems to get worse. What's not normal is if you forget the name of an object, so nouns, and if it's frequent, so you could do it occasionally, but oh, what's that? Oh, that device, to flip the pancakes. I need that. And you can't come up with the word spatula, for example, or something like that. And it's happening, fairly frequently. That's not normal. Forgetting, Jim's name, and when he passes by, someone says, well, that's Jim. You go, oh, that's right. I know that's Jim. Yes, it all comes flooding back. But forgetting things like spatula or, I need a new mouse or batteries or something like this, that's not normal. You should get in to see a doctor. That's something with the language skills. And some people have a little bit more trouble with processing speed. So a third area to look at is processing speed. So normal. As we age, we are slower mental processors. Don't worry about it. That's normal. The fastest our brain works at processing speed is age 20. And at age 40, you're slower than 20, and 60, you're slower than 40, and 80, you're slower than 60. So you're a lot smarter than you are at age 20 if you're older, because you have more experience and you can make decisions better, and you can. So you take your time, you come up with a great decision, you come up with a great conclusion, you problem solve well. It just takes you longer, no problem. That's normal aging. Don't worry about it. And that's very typical for normal aging. You just give it a little more time. How about visual spatial skills? So it is normal if you're driving to a new place, and maybe you didn't turn on your GPS or whatever. It's easier these days, but you get lost in a new area. Don't worry about it. That can happen even with a GPS, right? But it is not normal. You need to get in to see your physician if you're getting lost in a familiar place. You normally go to that store 2 miles away, and because there's orange barrels or something, you just get turned around and you can't find. Whereas that's not normal. You've lived there for probably over a couple of months. You should know, where the nearest store is and the gas station or your home or things like this. So if you're getting turned around more easily from your normal, some people were never good at directions, so if there's a change from your normal directions, that would not be normal to get lost in a familiar area. You go in to see a physician. A few other examples, math. So arithmetic, maybe everyone, you can do some arithmetic in your head, and you used to be able to maybe figure out a tip, right? 15% or whatever it is. And you used to be able to do that in your head. And normal aging would be, it's too much to do in my head. Give me a piece of paper, you write it down, you multiply out or whatever, and you can get the right answer. Normal, don't worry about it. You know the math, you can figure it out, you know how to add, subtract, multiply. You just need a little bit of a piece of paper because of processing speed, et cetera, and because of brain abilities, normal. But if even with a pen and paper, you can't do addition or multiplication, assuming you're used to, not normal. There's something going on with your calculation centers in the brain. Go in and get checked out. And then executive skills. If you're very good at organizing or planning, so for example, you used to be able to organize the treasurer or the secretary of your social club, or maybe you can get together a dinner for 6, and that takes a lot of organization. You got to plan, got to figure out what you're going to get, buy it first, cook it, to get it all planned in timing, and now you just can't do that. So there's a change in your abilities to do executive abilities, plan, organize, decision-making, judgments, less than what you used to be able to do. Those things usually don't change with age. Get in to see a doctor. That's something different. It's not because you just don't want to do a meal for 6 and you're too tired and you have arthritis. That's different. But from a cognitive standpoint, you can't figure this out. You're giving up your secretary for your social club just because too many people are asking you for this or that. How come my name wasn't on the list? I signed up for this. You didn't put me for this. You didn't send out the minutes for that. You used to be like this. Something's going on. Get in to see a physician. And then finally, personality. So normally personality is sort of, we keep the same personality all our lives. That's what personality is. And some people are more extrovert, some people are more introvert, analytical, etc. If there's a change in the personality such that they're not the same person, they're acting very different. Maybe they're less empathetic, and maybe they're more just self-centered, and maybe they have significant false beliefs or suspiciousness or paranoid, or could be some mood issues or anxiety that's way out of control. These are all suggesting of something going on in the brain. So go get your brain checked out. Those are clues that you should have to do that. Next, talk a little bit about how this relates to degenerative conditions, because a lot of people are concerned about that. So let me say a few extra words about that. So as I mentioned, dementia is just a broad overview term that just means you can't do things cognitively to such a degree that someone else has to help you. So there's hundreds and hundreds of causes of dementia. You may have dementia because you have brain trauma, or you had a herpes and meningitis, or HIV, or you have sleep apnea, or your kidney or livers aren't working well and they're toxifying your brain, or you're on chemotherapy and you got brain fog, or you have COVID brain fog, or strokes, hundreds of things that can damage the brain due to other pathologies that cause dementia. One of those are degenerative conditions. These are called Alzheimer's disease, or Lewy body dementia, frontotemporal dementia. And in these cases, the cause of the dementia is an abnormal accumulation of proteins that build up in the brain. And they build up and they accumulate, and they're toxic, and they start killing brain cells in certain areas of the brain. And Alzheimer's, it starts in the memory circuits. They have memory problems early on. So you always want to know, if you're being diagnosed with a dementia condition, you ask the doctor, what's the first name of the dementia? Dementia's the last name. Is it vascular dementia from strokes? Is it Alzheimer's dementia from Alzheimer's? Is it, sleep apnea dementia, infectious dementia, hydrocephalic dementia, multiple sclerosis dementia? You need to know the first name. So you ask them that to figure out what the treatments are. One of the best things to do for brain health is to get identified with these cognitive issues at the mild cognitive impairment stage, not wait till dementia. Normal, you're okay. It's when you're beginning to start seeing something is really when you want to get in, because we have so many more options for treatment and management if you catch things early, just like any medical condition. If you get a cancer at stage 1 or stage 2, well, you got a lot more options than if it's metastatic cancer. If you have mild cognitive impairment at early stage, all the medications say it's an early Alzheimer process. All the medications help better the earlier you start them. And for Alzheimer's, these abnormal proteins that build up 15 years in your brain. These toxic proteins are building up 15 years before you forget your keys for the first time. Your brain is functioning normally. You have no problem. We have this window of opportunity for 15 years. We can measure people's proteins. We can measure them in spinal fluid. We can measure them with a PET scan. And we can see if you have these toxic proteins that are suggestive of Alzheimer's building up. And before you forget your keys, before you have any cognitive issues, and when you're just beginning to have cognitive issues, we can start treating for Alzheimer's. And people do better if you treat earlier. And we're developing these new disease-modifying agents that are soon to come, have just started to come through the FDA, and are going to be more and more. So the earlier you identify that, the better. So don't delay. Get in to see your physician. They can identify these different conditions, what's causing the cognitive issue, what's the first name of the dementia, what kind of problem do you have, and get you started on treatments as soon as possible.
Thank you so much. I do have a question for you. So are there other things that might emulate or look like dementia, but it could be another condition, maybe some other type of illness or medication that you might be taking? And what might people look out for? How might they, detect that ahead of time?
Excellent question. So all those conditions that can affect the brain can all be cognitive impairment or dementia. So they all could be forms of dementia, maybe just not Alzheimer's dementia. So they could be toxic dementia from drugs or from narcotics or from medications that are very helpful for you. You have to always weigh balances, benefits and risks for any drug you take. So it may be worth it to take the chemotherapy drug, even though it sort of fogs you out, even though you know that it hopefully will start killing my cancer cells and I'll eventually live longer and that type of thing. So it's all a trade-off. One of the things we've been working on for many years is ways to detect early on just cognitive impairment. It doesn't say what the type is, what kind of dementia or cognitive impairment it's from, whether it's sleep apnea or medications or severe liver disease or strokes or whatever. You have to do other tests for those. But we've been worked very hard because most of the people that come in to see me as a cognitive neurologist, they would just arrive so many years after their symptoms began that it was like, why didn't you come in earlier? We could have done so much more for you. And they don't know what to do. And primary care doctors are Some are good, some really are not that good at careful at trying to identify these things. So we came up with this test that people can use. It's a free test. You can download it. It's called SAGE. Self-administered. You take it by yourself. Gerocognitive exam. You can just type in SAGE test in your Google or something like that, and it will come probably the first one there. And you can print off a copy. And it's a pen and paper test. It's 4 pages. You do it on your own. Don't cheat. And you fill it out, and then you take it to your doctor. And you provide, the doctor can then look at that, and based on what they know about you and your history, figure out, okay, the main issue or the probable cause of your cognitive issues is, X, Y, or Z. And you can measure this over time. We usually suggest people take it every 6 months or maybe even every year. You can see normal. Whoops. Here this last year, I've dropped a few points. That's unusual. And there's 4 different versions, so it makes it harder for you to memorize or learn the test. And you have to do it on your own anyway, so you still have to do it at the moment. And then you can go in and identify the cognitive issues early on. Is it Alzheimer's? We got treatments. Is it, sleep apnea, or your thyroid's out of whack, low B12, whatever it might be? The doctor can investigate, look for strokes, tumors, cysts, get your brain healthier, and that you can check on your own. Take it into your doctor, have a team approach. If your spouse doesn't like, maybe doesn't like to tell their doctor about their cognitive issue, they're embarrassed. Why should I tell them that I'm losing it? They don't want to bring it up. They have decreased insight. So take it at home. You're in the quiet of your home. Take the test, turn it in. It's a little easier. You don't feel threatened with someone giving you the test. What's this? What's that? You feel all stressed out. It's easier that way as well. So that's one possibility. There's hundreds of tests out there. SAGE is one that I developed. Happens to work really well. It's millions of downloads in different languages are on the website as well. So you can use that one. But for sure, just ask your doctor or tell your doctor about any cognitive issues you have.
So, Dr. Scharre, is there any specific age when they should start looking at that SAGE test? And, your 50s, you're looking at getting your colonoscopy done. So is there a specific age when they should start looking at these tests, or any type of indications that might lead them to take that?
So anytime you or your spouse or a good friend or someone who knows you well is noticing some change from normal, good time to take it for whatever age. Sometimes we'll give this test, before and after a chemotherapy, see if there's a change, or before and after a surgery. Sometimes it's good to measure if there's any change for events that you know about. But if you begin to notice something any age, go ahead and take it. If you get to be 65, that's Medicare age, about 3% of the population have dementia, so not a lot. So you can start testing yourself maybe at age 65. If you don't have cognitive issues, you can get a baseline and just sort of follow over time, maybe every 6 months or a year. For those of you that are digitally inclined, the SAGE test was converted to a digital application. It's called Brain Test. Unfortunately, they do charge for that one because they automatically score it for you and send the results and explain the results to you. So that one does cost. It's called Brain Test. SAGE is the paper form, exact same test. You can print that out and send it to your doctor, or just deliver it that way. So those are the times where I would suggest taking it, is 65 if you're not having any cognitive issues, and then anytime you're noticing or someone's noticing issues, just consider taking it then, so you get an overview of your cognitive status, and the doctor can then figure out, okay, how do we, any other evaluations we need to sort out the diagnosis and start treatments.
So we will put the link on the screen for everyone to be able to access the SAGE test if they're interested in doing that. So if I take the SAGE test and I go to my family physician about this, and they don't seem very receptive or want to make referrals for me, what can I do next? Or what would be my next step to get someone to listen to me?
Well, as with anything, you can have different opinions. So you can go to someone else. You can certainly go to memory disorder center. They would have experts in that area, depending on where you live. In the state, usually those are focused in larger cities. You can go to a geriatrician, go to a different primary care provider, or you can just, do the test every 6 months and then show them changes, over time. Perhaps that will do it. So yeah, it gives you an opportunity so you can have some more control other than just the doctor's not wanting to do anything. I have no control over this. At least here's a cognitive assessment tool that you can take to them or someone else that at least starts the conversation. Most docs want to do stuff for you. And if they see that, oh gosh, yeah, you're doing a little worse than I would have expected, we can't really explain that. We're going to keep a close eye on this. Let's test a few things, just like you might check over time for polyps in the colonoscopy or, mammograms or prostate health or whatever it might be. So it can be sort of a screening and a follow over time. In our one study that we did, over time, we measured using the SAGE test over time, and those that stayed stable, no problem. We started noticing a decline. Those eventually that developed dementia, we saw a decline very soon on the SAGE test. So as soon as the SAGE test starts declining the score, those that eventually developed dementia were really high. And so that's the time when to, really be pushing your primary care provider to look for answers for you.
Dr. Scharre, thank you so much for sharing this information with us today. And, I really appreciate you raising the importance of taking charge of your health, not just, your weight or your fitness, but also your brain health too. So we thank you so much, and we really appreciate all the resources that you have for us.
All right. Thank you. My pleasure.